Hi there, Karen here. So I'm here to share with you some very timely information. But let me ask you this. Do you wake up in the morning feeling tired? Do you feel satisfied and fulfilled with life? Do you suffer from chronic pain or have challenges with your weight? If any of these symptoms plague you like they plague so many people in society today, depression, anxiety, diabetes, and so many other things, well, I'm here to share with you this valuable information of a living science called yoga and Ayurveda. So let's go to see the master, Dr. Suhas at the Ayurvedic clinic. He is the director and he is my mentor. So let's go. If we look at Ayurveda as medicine and the word chikitsa, how would you explain that and the difference of allopathic medicine?
Well, the Ayurvedic concept of treatment is a multimodality treatment. We look at the person as not someone who is having or suffering from a disease, but how they lead their life, who they are, what their age is, what their vocation is, what kind of relationships, what atmosphere they live, everything what is responsible for leading to that disease. We are understanding that disease as a cascade of several imbalances that is happening in their doshas, dhatus and malas, which is leading to a disease. So it's not only treating the symptom, which is a disease,
Right.
It's treating the root cause of the imbalance. That is the very basic purpose of Ayurvedic treatment. We always look at people, it's about healing the person who is suffering from the disease rather than just treatment of the disease itself.
Right.
And so Ayurveda is actually an excellent science which actually talks about understanding the human being, understanding the person, and then teaching them around that how did they create the disease and how they can undo it. So there's a lot of education involved. Once you understand this is how I got sick and this is how I can undo it, not only you reverse that disease, but you also prevent onslaught of other chronic diseases also.
Right.
We use diet, routine, lifestyle, herbs, herbal formulations, panchakarma, detoxification, yoga, pranayama, yagyas, jyotish, gemstone, you name it. Every little modality is all very powerful. But we can't say that we can just use one of them.
Mm-hmm.
You have to use all of them in conjunction. And when you create a plan which is a very holistic plan, and that holistic plan which allows that person to mindfully interact with them in their life, the disease simply goes away. Because you have to make them aware and spiritual in order to really avert the diseases.
Right.
From an Ayurvedic point of view, health is a byproduct of enlightenment.
Yes. So what I hear you saying is it has more to do with creating an environment for health and healing as opposed to annihilating something that's shown up already.
And I think the biggest challenge is that many patients that we see nowadays, that they go to their doctors and tell them that I have a migraine, it's not my headache, it's your headache to fix me.
Exactly.
Okay, so it's that I'm not doing anything wrong, but it's your job to fix me. It's not like that. You have to be a team player for your own health and well-being. And if you can't do that, then nobody can help you.
Right.
And as a healer, as a doctor, as whoever is attending you, your job is to really understand that person very well and tell them and guide them and take them around the block one time, two times, and help them cultivate the learning and understanding. How to sync in their daily routine, how to understand their doshas, how to understand their body type, and what they need to do, what kind of lifestyle they need to adopt, what kind of food they need to be eating. So the education is the purpose of it. Ayurveda is a science which helps you restore the health of healthy individual and also alleviate any sickness or diseases that are happening.
Nice. It's about living naturally.
It's about living naturally, and so it's funny you say that because I see so many people who lead so much of unnatural life. They go to sleep whenever they want, they eat whatever whenever they want, and when they are sick they would like to come to us and find a natural solution for their unnatural living, which is not possible.
Yeah, it's kind of a double standard, right?
It's a double standard.
Yes.